What are vitamins, and how do they work? Vitamins are organic compounds that are needed in small quantities to sustain life. Most vitamins need to come from food. This is because the human body either does not produce enough of them, or it does not produce any at all. Each organism has different vitamin requirements. For example, humans need to consume vitamin C, or ascorbic acid, but dogs do not. Dogs can produce, or synthesize, enough vitamin C for their own needs, but humans cannot. People need to get most of their vitamin D from exposure to sunlight, because it is not available in large enough quantities in food. However, the human body can synthesize it when exposed to sunlight. Different vitamins have different roles, and they are needed in different quantities. There are 13 known vitamins. Vitamins are either water-soluble or fat-soluble. Fat-soluble vitamins are easier for the body to store than water-soluble. Vitamins always contain carbon, so they are described as organic. Food is the best source of vitamins, but some people may be advised by a physician to use supplements. What are vitamins? A vitamin is one of a group of organic substances that is present in minute amounts in natural foodstuffs. Vitamins are essential to normal metabolism. If we do not take enough of any kind of vitamin, certain medical conditions can result. A vitamin is both an organic compound, which means it contains carbon, an essential nutrient that body cannot produce enough of and which it needs to get from food. There are currently 13 recognized vitamins. Vitamins are either fat-soluble or water-soluble. Fat-soluble vitamins. Fat-soluble vitamins are stored in the fatty tissues of the body and the liver. Vitamins A, D, E, and K are fat-soluble. These are easier to store than water-soluble vitamins, and they can stay in the body as reserves for days, and sometimes months. Fat-soluble vitamins are absorbed through the intestinal tract with the help of fats or lipids. Water-soluble vitamins. Water-soluble vitamins do not stay in the body for long. The body cannot store them, and they are soon excreted in urine. Because of this, water-soluble vitamins need to be replaced more often than fat-soluble ones. Vitamin C and all the B vitamins are water-soluble. Trusted source. Types. Vitamin A. Chemical names: retinol, and 4 carotenoids, including beta-carotene. Deficiency may cause night blindness and keratomalacia, an eye disorder that results in a dry cornea. Good sources include liver, cod liver oil, carrots, broccoli, sweet potato, butter, kale, spinach, pumpkin, collard greens, some cheeses, egg, apricot, cantaloupe, melon, and milk. Vitamin B. Chemical name: thiamine. It is water-soluble. Deficiency may cause beriberi and Wernicke-Korsakoff syndrome. Good sources include yeast, pork, cereal grains, sunflower seeds, brown rice, whole grain rye, asparagus, kale, cauliflower, potatoes, oranges, liver, and eggs. Vitamin B2. Chemical name: riboflavin. It is water-soluble. Deficiency may cause araboflavinosis. Good sources include asparagus, bananas, persimmons, okra, chard, cottage cheese, milk, yogurt, meat, eggs, fish, and green beans. Vitamin B3. Chemical names: niacin, niacinamide. It is water-soluble. Deficiency may cause pellagra, with symptoms of diarrhea, dermatitis, and mental disturbance. Good sources include liver, heart, kidney, chicken, beef, fish, tuna, salmon, milk, eggs, avocados, dates, tomatoes, leafy vegetables, broccoli, carrots, sweet potatoes, asparagus, nuts, whole grains, legumes, mushrooms, and brewer's yeast. Vitamin B5. Chemical name: pantothenic acid. It is water-soluble. Deficiency may cause paresthesia, or pins and needles. Good sources include meats, whole grains, milling may remove it, broccoli, avocados, royal jelly, and fish ovaries. Vitamin B6. Chemical names: pyridoxine, pyridoxamine, pyridoxal. It is water-soluble. Deficiency may cause anemia, peripheral neuropathy, or damage to parts of the nervous system other than the brain and spinal cord. Good sources include meats, bananas, whole grains, vegetables, and nuts. When milk is dried, it loses about half of its B6. Freezing and canning can also reduce content. Vitamin B7 chemical name, biotin. It is water-soluble. Deficiency may cause dermatitis or enteritis, or inflammation of the intestine. Good sources include egg yolk, liver, some vegetables. Vitamin B9 chemical names, folic acid, folinic acid. It is water-soluble. Deficiency during pregnancy is linked to birth defects. Pregnant women are encouraged to supplement folic acid for the entire year before becoming pregnant. Good sources include leafy vegetables, legumes, liver, baker's yeast, some fortified grain products, and sunflower seeds. Several fruits have moderate amounts, as does beer. Vitamin B12 chemical names, cyanobalamin, hydroxocobalamin, methylcobalamin. It is water-soluble. Deficiency may cause megaloblastic anemia, a condition where bone marrow produces unusually large, abnormal, immature red blood cells. Good sources include fish, shellfish, meat, poultry, eggs, milk and dairy products, some fortified cereals and soy products, as well as fortified nutritional yeast. Vegans are advised to take B12 supplements. Vitamin C chemical name, ascorbic acid. It is water-soluble. Deficiency may cause megaloblastic anemia. Good sources include fruit and vegetables. The Kakadu plum and the Camu Camu fruit have the highest vitamin C contents of all foods. Liver also has high levels. Cooking destroys vitamin C. Vitamin D chemical names, ergocalciferol, cholecalciferol. It is fat-soluble. Deficiency may cause rickets and osteomalacia, or softening of the bones. Good sources, exposure to ultraviolet B, UVB through sunlight or other sources causes vitamin D to be produced in the skin. Also found in fatty fish, eggs, beef liver, and mushrooms. Vitamin E chemical names, tocopherols, tocotrienols. It is fat-soluble. Deficiency is uncommon, but it may cause hemolytic anemia in newborns. This is a condition where blood cells are destroyed and removed from the blood too early. Good sources include kiwi fruit, almonds, avocado, eggs, milk, nuts, leafy green vegetables, unheated vegetable oils, wheat germ, and whole grains. Vitamin K chemical names, phylloquinone, menaquinones. It is fat-soluble. Deficiency may cause bleeding diathesis, an unusual susceptibility to bleeding. Good sources include leafy green vegetables, avocado, kiwi fruit. Parsley contains a lot of vitamin K. Dietary sources. The 2015 to 2020 U.S. dietary guidelines focus on the overall diet as the best way to get enough nutrients for good health. Vitamins should come firstly from a balanced and varied diet with plenty of fruit and vegetables. However, in some cases, fortified foods' trusted source and supplements may be appropriate. A health professional may recommend vitamin supplements for people with certain conditions, during pregnancy, or for those on a restricted diet. Those taking supplements should take care not to exceed the stated maximum dose, as health problems can result. Some medications can interact with vitamin supplements too, so it is important to talk to a healthcare provider before using supplements.